Dylan Regan suffers from tinnitus. For the young musician, it's a ringing in the ears. He's had it since high school, but recently his symptoms have gotten worse.
It wasn't until I went to a symphony that I realized something was wrong, because I was enjoying it at the beginning and my ears started to really hurt. And then after that night, I noticed the ringing. I could basically hear it all the time, regardless of the environment.
But just what is it?
Tinnitus itself is generally characterized as a sound that people hear in their ears, usually a hissing or a ringing sound. Sometimes it's chirping noises as well. And generally speaking, patients can have it for very short periods of time. Some patients can have it for very long periods of time.
And it's for this last group that the condition can be life-changing.
This hasn't just affected my musical life, but it's affected virtually every aspect of my life. Because it's like almost every environment is going to have some sort of sound that's painful to me.
Exposure to loud noises usually triggers tinnitus, but there are other causes as well.
So some of the things would involve some specific medical conditions, potentially some vascular disorders. Certain medications can also cause tinnitus. Things like certain antibiotics, certain aminoglycosides in particular, that treat bacterial infections, also damage the ear, even something as simple as aspirin.
It can also be caused by a faulty brain-ear connection.
There are mechanisms within the brain and within the ear itself that actually act to amplify sound. And so that's another possible theory as to what happens, is that when you're in the quiet environment, your brain says, I should be hearing something. And what it does is it tells the ear system to amplify a little bit more. And so we develop those sounds that we normally wouldn't hear, but all of a sudden they become noticeable for us. That also creates a secondary problem that is often seen with tinnitus that we call hyperacusis, which is the abnormal perception of loudness, where things that normally for most of us would not be bothersome are actually very bothersome and almost painful in terms of how loud they are to the individual.
This secondary problem, hyperacusis, explains Dylan's pain. And there's no easy remedy for tinnitus.
We don't fix the problem. What we try to do is we try to habituate the individual so that they better understand the nature of the tinnitus, what the potential causes may be, and then try to go ahead and habituate out or retrain them in terms of how to perceive the sound and how to adapt and adjust to the presence of those noises.
Dylan is trying that therapy with a glass-half-full approach.
Nothing's certain. This could just be this problem for the rest of my life. But, worrying about that is only going to make it worse. So there's always the possibility of it getting better. And I think as long as I'm actively working towards that, working towards making it better, doing the therapy, that, I guess there is some light at the end of the tunnel.
Adam McCoy, CNN.